Welcome to today's OR Today webinar series. We're excited to have over 330 registered attendees for today's webinar. I want to remind you that today's webinar is eligible for one continuing education hour. The post-webinar survey and certificate process are now automated, so the survey link will be included in the follow-up email, which you will receive about an hour after the webinar has finished. Once you have completed the survey, you will be able to download your certificate immediately. This webinar is also eligible for 1 credit from ISHM and CBSPD. A separate email for this credit will be sent out by today's sponsor, Healthmark, during the next few days. Let's kick off today's webinar by giving an OR Today Live surprise pack to the attendee that can tell me the answer to the following trivia question. June is National Rose Month. What color is the rose that commemorates and honors Florence Nightingale? Answer now using the questions feature on your dashboard. While you're answering, just a reminder that our OR Today Live Surgical Conference will be taking place August 16th and 18th at the Omni Interlaken Hotel. This is in Denver, Colorado. Join us to discover new opportunities, broaden your knowledge, and exchange ideas. Registration is open for this live conference. For more information, visit ortodaylive.com. Also this year is the World Health Organization is celebrating the Year of the Nurse and honoring Florence Nightingale's 200th birthday. Help us celebrate by sharing a standout story about you or a nurse in your life. Each submission will be entered to win a $25 Bath & Body Works gift card. Visit ortoday.com contest to enter. All right, let's see who the winner for today's trivia question is. Congratulations to Tracy Young. Tracy, you're going to receive the OR Today surprise package. One of our team members will reach out to you shortly on this webinar to get your contact information. You were correct that the answer was white. It is a pure white ruffled rose. OR Today would like to thank our sponsor, Healthmark Industries. Since 1969, Healthmark Industries has developed and marketed innovative solutions to aid healthcare facilities in their delivery of surgical instruments and other life-saving medical devices to patients. Healthmark Industries' mission is to continue to innovate, continue to support, and continue to serve the healthcare provider industry and support services that make it possible to deliver quality health care. Please visit hmark.com. That's hmark.com for more information. Our presenter today is Kevin Anderson, Clinical Education Coordinator for Healthmark Industries. Kevin, can you hear me?
I can hear you.
Awesome. Kevin, you may begin whenever you're ready.
All right. Thank you, Jamie. And thank you, everybody, for joining me today for this webinar. The title is Communication Tools, More Important Than Ever. I think by the end of this presentation, you'll agree with me if you don't already. As Jamie said, my name's Kevin Anderson, Clinical Education Coordinator at Healthmark. As you see on the screen, my email is there. Just in the event that any questions or feedback or anything that comes up during the presentation that you think of, you can reach out to me, send me an email. I'd love to get any of your thoughts at the end, and I will also post this again at the end of the presentation. Healthmark is a manufacturer of healthcare products, but we also have a policy and philosophy. We not only want to provide the highest quality evidence-based products, we also strive to support our customers with education because we believe an educated customer is our best customer. And this presentation is a part of our commitment to educating our customers. And so with that, we'll just get started. So every presentation, we have to have objectives. And what we want to do with this presentation, we want to review the various laws, standards, guidelines that are used within medical facilities concerning labels, signs, symbols, tags. These are all methods of communication, right? And we want to comprehend the important role that labels, signs, and symbols and all this stuff plays in a medical facility. And then we'll understand the impact of improper labels, signs, and symbols, tags on patient outcomes and staff safety. And with that, before we get really into it, we'll start with a poll question. I know Linda and Jamie are going to help me out with this, but we'd like to find out what department you work in.
Absolutely, Kevin. The attendees should be able to see the poll now. What department do you work in? There are a couple of options listed there for you: operating room, sterile processing, pre-post-op, management, administration, and other. We're going to give the attendees a couple of moments to go ahead and self-title themselves as far as what department that they work in. Linda, I think we're good to go ahead and close this poll and share some of the results. It looks like the majority are going to fall into sterile processing, management, and other. We do have a couple of people joining us from the operating room and pre and post-op. So Kevin, we'll close this out and turn it back over to you.
All right, excellent. Thank you for your help, Jamie and Linda. I appreciate it. Okay, so no matter where you're from, it sounds like a lot of sterile processing folks out there in management. It's great to have all of you though, no matter what, because signs, symbols, labels, they're in our everyday life, but they impact all of us no matter what our title is and no matter what our function is in the hospital. So what you see now are some examples of modern signs or symbols. Each one is designed to instruct and inform with the purpose of creating a safer environment. As you see in this picture on the left, now we have these floor signs for social distancing while we're in the grocery store, or the one in the middle here that shows you which way you should be going down the aisle. Of course, you still have people who decide to go the wrong way, right? Hopefully they're not going to go the wrong way when they see the sign on the far right when it says alligators and snakes are in the area. That would be really bad, as if COVID-19 isn't bad enough. The alligators and snakes would be enough to make me turn away. So this is a sign that we're all familiar with, and one that recently has hit home with me, as I now have a 15-year-old learning how to drive. Driving is a skill that is overwhelming in the beginning. It requires so much processing of information, and yet we eventually become so good at it that it almost becomes automatic, at least in the environments we're most comfortable with and acquainted with. I mean, have you ever driven somewhere and totally have zero recollection of the driving details when you get to your destination? Your mind was wandering, thinking about your day or something else, and now you arrive, but you don't even remember exactly how you got there. This happens to me all the time, but how do you cram all of that driving experience and all of those things that you learn that allows for you to do that into the head of a 15-year-old who's who's brand new at this driving, and the road looks like this to them, right? No matter how simple it is, when they're on the road, it's complicated. They're really trying to struggle and take in all this information and stay safe. But part of the reason why we do get into that automated driving mode is because we learn how to take in all this information through signs and symbols, traffic lights. All of these things are telling us and indicating to us things while we're driving so that we can get to our destination safely. And not only that, we're always using them too, right? Turn signals, of course, those seem to be optional for some people, but we like to use turn signals. We have a dashboard with all kinds of signs and symbols inside our car that give us feedback as well, right? But those are just some of the ways it helps in driving, but healthcare is very similar. They play a very important role in our safety in the hospital, like they do in driving. They give us critical information without having to say a word. Here are some signs, some of which you may see now that are newer, like the quarantine sign. That one is definitely a sign of our times, while others have been around a long time, like the blue hospital sign. Then you have labels like you see on the jar. Maybe it contains formalin or some sort of specimen fixative. And the first one is a sign from a clinic that my friend Stephen Kovac went to, instructing people to stay off the rolling stools for their safety. All these signs are designed to enhance communication and safety. The stakes are higher in today's healthcare setting. By the time patients are under your care, they are usually sicker than they used to be. There's problems with antibiotic resistance. We also have pressures on us to work more efficiently because of the ever increasing costs of healthcare. with that push to maximize our time in the OR, SPD, or wherever you work, comes an increased risk for error. So we need to be able to utilize and understand the signs, symbols, labels, and other communication tools that we use every day. So getting into objective 1, we're going to review some various laws, standards, and guidelines within the medical facilities, like the FDA, which we're going to get into right here. So FDA gives guidance to manufacturers. This one is a document that was updated in 2015. And as you can see here, they talk about device labeling. It's top of mind. They're telling the manufacturers of products some guidance on what they should be including in their labeling. This is very important, and they know it. And here's an article. This is an example of an article that specifically talks about how visual language can enhance medical device labeling. It talks about some of the symbols or visual language that you often see on your medical product packaging. These are all important because they help us to understand very specific things about the product. Again, with minimal time wasted reading through complex manuals. One that I remember using or referring to a lot in the operating room was our use by date, right? We wanted to check for expirations all the time, and we had to be careful because sometimes we'd confuse it with the date of manufacturing, which unfortunately was almost always past due, right? The date of manufacture was always somewhere in the past, so you could easily mistake the two and think that you had an expired product. So it was very important to take the time and look at that packaging, make sure you were dealing with a product that wasn't expired and that you were actually reading it appropriately. So these are just some standards recognized by the FDA. There's some that deal with cardiac rhythm management devices and their labeling, general requirements for symbols to be used with medical device labels. There's another standard that talks about graphic symbols for use on equipment and other registered symbols. So the FDA utilizes these standards, and they look to these references to also give their own guidance. So industry standards are important to be familiar with, and they are important to the FDA as well. So here's an example of a universal drill guide IFU. Okay, this entire IFU that you see right here is using only pictures and graphics and symbols to show you how to handle this IFU, or this instrument, excuse me. And it's using all these little symbols here that mean different things. And basically anybody would be able to pick this up and learn how to handle it based on these symbols. And if you've ever put together any furniture or whatever from IKEA, maybe you're already familiar with IFUs that are only pictures. It makes it easy in terms of having to limit the languages and all that we have to worry about, right? And all those things are more open for interpretation, whereas these pictures and symbols are not. So here's some packaging symbols. The number 2 with a line through it means the item should not be reused. It's a single-use item. This is an interesting one because currently we have been given some unusual permission to reuse single-use devices, right? The N95 masks. This is something that you don't normally see, but the government had to step in, help the industry address the shortage of PPE during this pandemic. The picture of a book with an eye in it. It means to consult your instructions for use. This is a great one because you'll see it on almost all medical devices. I can't help but think about all the times that I have bought items at home that require assembly and I don't read the instructions because for some reason I think it's going to go quicker if I don't take the time, and then normally I end up finding out it takes longer because I'll inevitably have to go back and consult the directions. So I should just do it in the first place, right? But in healthcare, that's different. We need to always be mindful of the instructions before we go ahead because really bad things could happen if we don't. And then lastly, that triangle containing the words non-sterile indicate the item isn't sterile and should not be placed on a sterile field. When I see this, it reminds me of doing cases in the OR that required human tissue. If you've never done cases with human tissue, you wouldn't know, but if you have, you might recall that's a lot of times they have 2 or 3 outer wrappers, and oftentimes that outer one isn't sterile, and then you gotta understand which ones on the inside are sterile so that you can present them to the sterile field appropriately. So you have to really be careful of that. Here's another product example with several symbols on it, right? The first symbol probably means that there's a temperature limitation. So you may, in order to find out what that limitation is, then you might consult the IFU for that. But at least now you know that there is a temperature limitation for it. That second symbol means to keep the packaging away from direct sunlight. And the third symbol indicates to keep the package from getting wet. And lastly, that one we already discussed, it's a single-use product, right? So a lot of information was given to you with symbols that could be nearly universally understood. So just a little bit about OSHA's bloodborne pathogen regulation. This regulation gives us direction on how containers of hazardous solutions are to be transferred from one container to another and how they need to be labeled appropriately. And we'll get into that a little bit more as we go. Little bit more about this bloodborne pathogen regulation. This standard is really important to be familiar with if you work in the OR. The OR usually addresses these concerns with the use of case carts and finding ways to label them, whether they're clean or biohazardous. But today, we often have many departments throughout the hospital, or maybe in off-site locations, that are now sending reusable items to our sterile processing departments, and they also need to be following the same regulations, right? You're servicing OB, you might be servicing ER or some clinics off in the neighborhood. They need to be following the same guidelines, and those containers need to be puncture resistant, leak proof on the sides and bottom, and marked appropriately, whether it's biohazard or clean if you're returning it, right? So OSHA also has a hazard communication standard. The important thing here is that OSHA requires the use of pictograms on labels in order to alert users of the chemical hazards that they may be exposed to. They know that this is important. You can use these pictograms to convey important information to the users who may or may not be able to read or be familiar with the language. So these are just some examples of pictograms that you may or may not be familiar with. And just going from left to right, that first one indicates a carcinogen or mutagenicity or reproductive toxicity and a host of other potential issues. That second one indicates that there could be skin corrosion or burns or eye damage. It's corrosive to metals as well. And the third one is an irritant to the eyes and to the skin. It's a skin sensitizer. It can cause acute toxicity and among other things. And that last one, no, it's not a bottle of wine and it's not happy hour symbol. It's gases under pressure. It does kind of look like a bottle of wine, but that's not what it is. It's gases under pressure. So SDS, the safety data sheets, used to be MSDS. Now it's the SDS. It's important to know what's in your area. Do you have the appropriate training? Understand the different sections and what they mean, like the fire diamond that you see in the upper left there, in that upper left corner. So the 4 divisions are typically color coded with red on top indicating flammability, blue on the left indicating level of health hazard, yellow on the right for chemical reactivity, and white containing codes for special hazards. And then each of those quadrants are rated on a scale from 0 to 4, 0 being minimal hazard and 4 being a severe potential hazard. This is an example of labeling for alcohol, which is a common skin prepping agent in the operating room. Sometimes it's used by itself, but other times it's an adjunct to other skin preps. But it's very important because there's fire risk in the OR, and alcohol dries differently. This is something our OR folks will need to be mindful of when they're prepping skin. And if it gets into the hair, and that it takes a lot longer for it to dry and become less of a fire risk. But these are really important to understand that SDS, knowing how to find them for the chemicals in your department. and get that part of your yearly training as well. So AORN, AAMI, they both support accurate labeling, because it provides identification of the package or container's contents, as well as information that enables tracking of sterilization cycle, the personnel involved in the sterilization process, contaminated items, are they labeled in an OSHA or EPA compliant container? All of those things are important and called out in AORN and AAMI recommendations. So AORN and Joint Commission on labels. Joint Commission had a national patient safety goal that mandates labeling for medications on and off the sterile field. Label information must include the medication's name, strength, as well as the amount of medications that are mixed. And think of the tumescent, the irrigations, the heparin solutions, all of that. We need to know the unit of measure, percentage, milliliters, units, all of that stuff. AORN also supports those guidelines. And furthermore, it's just best practice. It's safe practice in the operating room. You never know when someone might have to relieve you. How are they going to know what's on your sterile field and without those labels? Also, something that maybe this is something I didn't even really know until I was working on this presentation, but anesthesia labels have an ISO standard. Like the ones that you typically see on that anesthesia cart, they're standard color coding and require specific things to be on that label. These are very important and help to make more of a universal system for labeling anesthetics. So AST on labels, they have standards of practice as well. And they say proper handling and care of specimens begins during the preoperative phase of patient care, and preparations, including all communication, should involve the surgical team. They also say in the standard of practice 2 there that the cleaning of instruments should continue at the point of use post-procedure, with instruments being placed in a leak-proof container with a lid that is labeled for biohazard for transfer to the decontamination room. AST has very strong stance on the labeling of specimens and biohazard. So you're starting to see a theme here. Different organizations, whether it's FDA, AST, AORN, AAMI, they all support the use of proper labels. So they have another standard of practice 6 about labeling prior to being sterilized. Packages should be labeled prior to being sterilized. They have to be, you have to know the contents of the package. You have to know all of these things for the purposes of quality assurance, inventory control, rotation of stock. So what sterilizer did it go in? What cycle was it? What was the Julian date? All of those things are very important to monitoring your sterilization cycles and your products and ensuring quality in your department. Another one is taping. Taping is a label that we put on instruments to identify it for a service or maybe for a doctor. And taping has come under fire, but really AST does support it. Studies have confirmed that the use of colored tape does not interfere with the sterilizing agent contacting the underlying surface of the surgical instrument, but it has to be done right, and we'll show you one that isn't the best example a little bit later. But manufacturer's instructions and healthcare facility policies should be followed for the use of colored tape labels on surgical instrumentation. Biomed, okay, so Joint Commission has a standard regarding equipment and asset management. Joint Commission wants to see asset management in your facility, so our equipment needs to be inspected, whether it's for preventive maintenance or for performance tests or what have you. These labels that go onto these equipment, like you see in this picture here, it tells you when it's due for inspection, right? And this is something that we should be looking for, whether it's in our SPD or if it's in our OR. We should be looking at our equipment to make sure it's not due for service and that it has been checked in by biomed. Again, pump, you got IV pumps there, and these IV pumps can get damaged through the cleaning process or normal wear and tear. We want to make sure that asset management includes the use of labels to show that these things have been taken care of, but we also have to manage those labels in case those labels get destroyed or whatever through the cleaning process and the normal wear and tear. We need to take care of those labels as well. So a little bit about endoscopy labeling. All of these organizations you see here, AAMI, AORN, SGNA, all of these organizations have recommendations on labeling and storing of endoscopes, whether they're dirty, ready for patient use. There are various requirements. AAMI states that information like the date of processing, name of processor, the date of processing should be included on a tag. And AORN says a distinct visual cue that clearly identifies flexible endoscopes as processed and ready for use should be on the endoscope, distinguishing it from any unprocessed endoscopes. And then SGNA also says once there's confirmation that an endoscope has been properly reprocessed, it's suggested that a system exists for identifying scopes that are clean and ready to use. And I think that's a pretty good standard to uphold in your facility, as I can't imagine having a used endoscope used on me. I would hate for that to happen. So that gets us into our second objective. We want to comprehend the important role that labels and signs, symbols, and tags play in the medical facility. So we're going to go through a bunch of examples here, and then just think about them from your role as you look at them, whether you're, sterile processing, operating room, management even. Managers have a lot on their plate, but they have to work with their educators and their quality assurance folks to work on education materials and getting people familiarized with all these different signs and symbols and labels and all that in their facility. So here we go. We have in the top left, we have a couple items here ready. They're anesthesia blades for intubation. We have labels on them. We have a label here that's kind of hard to see. That's a sterilization label. In this one, we can see the indicator inside the package that tells us that it's gone through a sterilization cycle. It might be behind the label on this one, but those are our visual cues that tell us this thing has been reprocessed. We can use it. This is that tape that we were talking about earlier. This is an example of tape that doesn't look so hot. You don't want your tape chipping like that. And there's potential for those tape chips to fall into the surgical wound or potentially maybe harbor bioburden underneath it because it's clearly not staying on appropriately. In this picture here on the right, you have surgical instrument trays. You see the white wrapper. Typically, instruments are wrapped in blue, so maybe that white is actually an indicator of some kind, a sign that maybe those instruments are different. Maybe they're loaners. So there was probably some purpose for making those white. But we also have indicator tape that tells us this thing's been sterilized. We have this pink label here that says implant. It's hard to see, but it's there, right? All of those things are conveying messages. Again, without even saying any words, you know a whole lot about those packages, right? And then in this lower left corner, you have somebody presenting a sterile item out of a peel pack. A peel pack is meant to be opened a certain way, and hopefully your peel packs have the indicators that are necessary and the directions on them with lot numbers and things like that communicated so that you know that your peel pouch is ready for use. And the OR needs to know what that looks like as well. So what are these pictures telling us? I know I have a lot of sterile processing folks on this webinar, so I'm guessing a lot of you will know right away that what I'm trying to get at here is that we know these items here on the left, yeah, they're poorly stacked. That should not be, right? But aside from that, we also know that these items were not sterilized. Do not take those to the OR, right? That should not happen. So if that rep comes down bugging for these trays because they're not done yet, don't let them take them, right? And then you have this rack of instruments over here. You might wonder, have those been sterilized or not yet? But yes, we know we have the visual cue right there to tell us that those things have been sterilized. And that's what's so great about all these quick visuals. Here we have a picture on the left. You have the label of the instrument set there, which is great. You have a lock that has some tape on it. It looks like maybe the lock broke and somebody tried to tape it back into place. Now, being a former OR nurse, I wouldn't accept that. I would be worried that maybe the lock broke and something happened to the seal. Maybe it even came off a little bit and someone tried to fix it. I would not accept that instrument tray. So hopefully in your SPDs, you're not sending any instruments up like that. But again, we have another package here in the middle. This one has, again, it has indicator tape on it. It looks a little different. It doesn't have black on it, right? So maybe it was a different sterilization modality. Maybe it was vaporized hydrogen peroxide. And then of course we have our label and our load sticker label, which you see a bigger version of here that we often place on the packages with labeling guns like that. So a lot of information coming at us visually. Here we have all kinds of examples of labeling fluids and things like that, right? Over here, it sort of looks like we have items out there, fluids out there, cleaning agents that maybe weren't properly labeled, right? We see some of that going on over here. There was maybe some dates and initials and things like that, but we don't see that here. And we see a mixed bag of that going on over here. Maybe there was some initials here, but it's very important that whatever the policies and standards are at your facility, that you're labeling all of these items appropriately as you go, so that whoever comes in after you, there is no doubt what was done with that item and that it is safe to use. A surveyor would love to come in and see all this and just start asking questions. What happened to all these fluids in here? So we also use signs to reference, right? We have guides that we put up on our walls. You know, we do quality checks in SPD. So we might have wall charts that help us to identify and interpret the results of our quality tests. We might have something like this that helps us to understand how to do our peel pouches. It's just a quick reference guide, right? But if we use these in our department, we need to make sure they're laminated and that they're cleanable and that they're presented in a way that infection control would be happy with, right? And our surveyors, because they contain a lot of useful information. We need them, and they're great training aids and they're great guides to go back to, but we have to do it the right way. Now here you see a lot of different, well, 3 different setups, right? And what's important is hopefully there's some organization, but things that you might notice at any of these stations is they have some labeling here on this one. They have some solutions there that may or may not be labeled. It's hard to tell with this picture. Same with this one. You know, they're all supposed to use labeled items, that everything has its place. They might be using labels here to indicate that there's an instrument set that is incomplete. Maybe there's missing instruments, right? Or maybe there's a quick turnaround, and so they have labels for those different items. So no matter where you're at, make sure that everything is getting adequately labeled and applied to your instrument set so that you're communicating a complete picture of the product you're sending to your OR folks. We see labels for case carts. You know, from that picture on the left, you can see that case cart real easy. It's dirty. We know we're gonna have to be wearing PPE if we're touching that. The one in the middle, it's clean. We know we're safe to touch that. do what we need to do. And then some case carts are totally uncovered. They look different, so you have to have a different system. That one on the right, it's got its own cover on it. It does have its own biohazard symbol on it. Hopefully it's in a laminated uh, holder of some sort so that we don't have to worry about it getting contaminated and not being able to clean it. It sort of looks like it is, but that's what we want to make sure when we have different case cart situations. Now, remember, we mentioned before, we don't just work with the OR who uses case carts, we work with clinics and offsite locations and other floors. So when we're transporting their reusable devices, we have to have a system in place for communicating. Okay, this stuff looks like it has biohazard bins, but it's covered in a dust cover and it looks like it might have a clean sticker like you see over here. Looks like it has a clean sticker, so that's probably some sort of clean delivery cart system. In the middle, you don't have a red bin, but you do have it clearly marked with a biohazard symbol. And then over here, we were concerned, you know, we have a biohazard bin, but we want to return reprocessed items to that clinic, so we put a dust cover around that bin and we labeled it clean. Everybody knows there is no question, is this thing ready to go or not? It's ready. And we labeled it as such. Sterile storage, right? We want to make sure everything is organized, everything has a place, and everything's in its place. Something I kind of liked here, it looks like they have some sort of color coding over here, which is really cool. Over here, you can see things are very neatly put into a place and they're labeled. They might have reorder information, things like that. In the picture on the right, you have these signs. You have signage like the letters there for locations, right? Storage locations. But you also have that tape that indicates, hey, nothing should be going above that. It needs to be 18 inches from the ceiling, right? So those are great ways to label or put signage up to indicate things to everybody, to communicate that message. So equipment. What's going on with that picture on the left? We have that exclamation sign and that electrical sign. There's caution and warning there, right? It's telling us, you know, there is risk involved with handling this machine. In that picture on the middle, that ultrasonic, they have a sign right on top. It's hard to tell what it says maybe for you, but it says it's a hot surface, do not touch. And that's actually kind of an important point to note, right? Ultrasonics, they don't normally get really hot, right? Well, this is a different type of ultrasonic. This one has thermal disinfection. It gets really hot. So that's a really important point to note, especially even for seasoned CS staff, right? And then we have this picture on the right, the date of inspection by Biomed or whoever the medical company is, and when the date of reinspection is due, all of that stuff, it's telling us a message about those items. So the operating room, you have the back table. There's guidelines about specimen labeling. We talked about the medication labeling, all of those things, right? Because you can see in the picture here on the left, you have medications already ready to go. You have in this picture a set that looks like it's ready to go, right? And we're gonna revisit that set, this picture on the right, in just a little bit. But there's stuff going on there. There's a symbol here, an indicator that should tell you something very important about that instrument set, right? So those are very important things to check, whether you're in the operating room or whether you're, you know, getting your instrument sets ready. So we mentioned specimens in the OR. Labeling specimens is extremely important. These are what go to pathology and help the doctors find out what's going on with people. What is their plan of care, because it depends on what happens with that specimen a lot of times. Is it cancer? Is it not? Whatever. And what kind of specimen is it? Is it fresh? Is it frozen? Is it permanent? All those things. So it may or may not need formalin. It may or may not need saline. It may or may not need to go with no fixatives or no fluids on it at all. So the labels need to reflect that. Specimen errors are common due to labeling issues. Even with the institution of electronic health records and Epic and all that, we used to have a hard time reading people's chicken scratch on a label. Now we have to figure out at our facility what's unique to our facility. How do they want us to label these things? No longer is it a different label for Dr. A than Dr. B. It's usually more of a standardized procedure now, but it is still complex sometimes, surprisingly complex. So we need to make sure that we're labeling our specimens correctly. So objective 3, we want to understand the impact of improper labels, signs, symbols, tags, and on patient outcomes and safety. So we're going to look at some examples in this section. So eye wash stations and what you need to know, you know, if an audit was performed on your department, would you pass? That's what you need to ask yourself. If your eye wash station looks like that one in that picture, hopefully you can know just by looking at that real quick that you're not going to pass like that. So we need to, the challenge with eye wash stations is that we don't use them every day, right? So they're easy to forget, easy to neglect. And if our facilities folks or whoever's responsible for checking your eye wash stations misses one or doesn't know where it is or has no idea that it's there, we need to make sure that we're doing this. ANSI, AAMI, ST79, OSHA, all of them, they all have standards around eye wash stations, which we're getting into right now. So ANSI, AAMI, ST79, you have to have a suitable eye wash shower equipment must be available with unobstructed access for immediate emergency use in all locations where potentially damaging chemicals are used. You might be talking cleaning solutions, disinfectants, EO, hydrogen peroxide. Pretty much wherever you are in the hospital, you're going to have some possibility of interaction with these chemicals, because every place in the hospital gets cleaned, right, by EVS. So there's some potential almost no matter where you're at. But these eye wash / shower stations need to be located within 10 seconds of travel time of all chemical usage locations. They need to be identified with highly visible signs and maintained in accordance with the manufacturer's IFU testing and maintenance. They got to be documented, all that stuff. So OSHA and ANSI, this is another standard. The requirements specify that where the eyes of the body of any person may be exposed to injurious corrosive materials, suitable facilities for quick drenching or flushing of the eyes and bodies shall be provided within the work area for immediate emergency use. So again, it's agreeing with what I just read from ANSI AAMI, right? So all of these things have to be available and they have to be tested. And one important note here is that it does need to be tepid water. This is tepid. When I first heard that from a surveyor, not a surveyor, but an educator that does surveys, my immediate question was, well, how much is tepid? What temperature is that? So it's between 60 and 100 degrees, right? So that's something that we didn't check. So that was something that we had to institute after that survey. Another thing to know is that OSHA does publish a recap of violations. There are financial penalties. You see up to $1 million there for eye wash and stations that are not maintained or that are just not there. So even if you don't have one there, that could be a potential issue. So make sure if you have an area where you're using chemicals that you know there's not an eye wash station accessible, you get it taken care of. Here's another couple of examples. Eye wash stations, they're not supposed to be in decontamination sinks. You should not be flushing your eyes where there's the decontamination of instruments and things like that going on. So that's actually incorrect. In this picture on the right, we have another issue there because it's supposed to be continuous flow You know, you should be able to flush your eyes for 10 minutes, hands-free. Those types of eye wash stations are no longer acceptable. Here we have another example. You know, the eye wash station, again, I'm not sure if this is completely hands-free, which it's supposed to be, but the caps are off, and when you look close to this thing, you can see there's all kinds of debris. And if those caps are off and you can see the decontam sink there, I'm sure it's getting splashed on the daily with nasty stuff, let alone all this sediment that who knows what that is too. I know there could be hard water and all those issues as well. And it does look like it's been maintained or checked, but there's a lot of issues still wrong here. Here's another one where you have an eye wash on the left. It's not immediately accessible. It's not hands-free, and the sign isn't very good necessarily. The one in the middle looks pretty good for the most part, but again, you need that big sign available. And then the last one you saw up close and personal already, you know that one's nasty. This one, again, you got a few issues here, right? You're in a sink. It has some clue here that you're in a decontam sink, right? Again, so this is in the wrong place. You have a cap missing. So now that thing is being exposed to the nasty stuff in that decontam sink. And then again, you have a record here that is completely blank. You're just opening yourself up for questions from those surveyors. I mentioned earlier about testing the eye wash station for temperature. This is one simple solution you could institute really quick. Use a crystalline thermometer. You can run your fluid, your eye wash over it. You can check the temperature, real easy, document it. Oh, I mentioned documentation, right? Have the documentation available. If it's on a paper form like this and you want to keep it by your eye wash station, this isn't a plastic holder. It's an example that you can have all the boxes getting checked, all the dates put in there. That's very, very important. For our OR folks, right? Site marking. This is huge, huge, very, very important. It's required by CMS, supported by organizations like AORN, the World Health Organization. Joint Commission developed a universal protocol to provide guidance for surgical site marking. And yet there are still occurrences to this day of wrong site surgery. This could be one of the worst things that could happen in the operating room. There is a study referenced here at the bottom that showed that the occurrence of this happening is approximately 1 out of every 112,994 cases. What that equals to in sort of a large facility is about 1 occurrence every 5 to 10 years. And I will say in my 18 years of experience in the hospital, I can remember several close calls for wrong site surgery. That's something you don't ever want to even come close to. It's very, very scary. Never experienced it myself, but I know at a hospital very near mine that did go through that, and that's just a horrible thing. And there's a lot of protocols in place, policies, procedures to make sure this happens accurately every single time. Gotta follow it. Some new signs, right? New signs of our times. We have gloves and masks. We have wash hands frequently, at least for 20 seconds. Social distancing. These are the measures we need to take account for when it comes to containing the spread of COVID-19. That's very important. And it's very important to communicate your messaging to the people in the hospital that are visiting, and that you have a ton of people coming in there at any given time. You want to make sure they understand what they're supposed to do. They have diverse backgrounds. These signs make it possible to communicate to almost everybody. Labels on a mask, right? N95s, NIOSH, they have this great blog referenced in the bottom here. They talk about all about the labeling and what it means and all of that stuff. Very important information. Because I'm trying to get through and get to the end of this, I'm not going to spend as much time on this part, but I do recommend that you go and check this blog out. Very interesting blog. And when it comes to protecting yourself with N95 mask, this is very important stuff to know. Look at this package. It says donated human tissue, please handle with care, store at 15 to 30 degrees Celsius, right? Well, I found this in our storeroom, and I found it and I knew it wasn't ours. so I just knew to keep an eye on it. It was actually on the floor in the middle of in the corner of a storeroom, and it felt like it was obviously out of place. And then I kept seeing that it was there for days, right? Well, what if that was a dock and somebody left it there on a docking station where it gets really hot in the summer, and all this human tissue, thousands and thousands of dollars worth of human tissue, just sitting there, it could have gone bad. Or maybe the vendor is bringing this to your facility and you have no idea where it's been. If you see stuff like this just sitting in your areas, your storage areas, you need to take care of it. It's very important. I hope that, if someone needs to use human tissue on me one day, that all of those people that were in the chain of custody of that tissue were handling it with the care, taking care to store it the right way. It wasn't left in somebody's trunk getting really, really scorching hot during the summer over the course of days, right? We want to make sure this stuff is very, very important. That those labels had a lot to say, right? And then I'll end with one last story before we sort of recap, right? We showed this tray earlier. I want you to imagine, most of you are sterile processing folks, but imagine you're an OR person, you're about to scrub in for a case. You're going to relieve the day shift, and at the beginning of your shift, they're going home, you're coming in, you're scrubbing at the sink, and you can see by looking through the window, they're getting close to finishing. It's a routine case, just a port implant for a patient, right? And then you go in, you do your counts, you do your report with the scrub, and they go on their way. So now you're involved in the case. Now you're trying to help the surgeon close the wound, dress the wound, all of that stuff. And you start looking for things on your back table and do a count with your circulator. And then you see an indicator that looks like this. Unfortunately, that is a real story, right? That happened. So if you're a CS folk, if you're an OR, this OR tech had been in the OR for decades, and they missed that simple sign, right? And if you're an SPD, you want to make sure that your trays are not going up without being fully processed. Don't be pushed beyond your limitations. Make sure your processes are solidified and that you're not causing undue harm. That's how important all these signs, symbols, labels, that's how important they are. Every little detail is so important. So just to recap, right? We talked about the various laws, the standards, the guidelines. We went about the important role that labels and signs and symbols and tags and all that play, right? And then we gave you some examples of the impact of improper labels, signs and symbols, communication. So with one last poll question, can you say that communication in your facility is very effective? And one last time, will Jamie and Linda help me out with this one?
Absolutely, Kevin. The attendees are now able to see the poll in front of them. The question that we're asking after Kevin's wonderful presentation, can you say that communication in your facility is very effective? Please select one of the following: strongly disagree, disagree neutral, agree, or strongly agree. I'll give you a couple of more seconds to go ahead and lock in your answer. And then Linda, if you'll close out the poll and share the answers with us. It looks like the majority, 49% of the attendees today, will agree with the statement that communication in their facility is very effective. I'm happy to hear that. Following that is neutral, and of course, 16% is strongly agree. So Kevin, we're going to close this out. I'll turn it right back over to you.
All right, thank you so much, Jamie. So, you know, no matter what your thoughts and feelings are regarding communication in your facility, there's always room to improve. I don't care where you're at, and no matter what the circumstances are, you always have to stay vigilant, right? You have to be open-minded to the potential issues, right? So what can you do about it? Learn about those various signs, symbols, labels in your facility. What are the communication tools you are using? Add them to your competencies for onboarding, your annual education. Make sure everyone knows how to interpret them, right? How to use them effectively. And then be intentional about using these communication tools and applying them to your practice every single day. So in closing, think about it. Labeling your patient's body part for surgery, eye wash stations, timeout boards for procedures and surgeries, communication boards for surgical counts, count sheets, indicators, labeling for surgical trays, and then there's new signs and symbols all the time, right? We're always adding to that, just like we did for the pandemic. And we can do it in our facilities, and I encourage you to, especially if they're gonna be useful and communicate really powerful messages. I kind of forgot to add a slide with a sign that I had in my department. I wish I would have put it in there, but instead I put this one in there. Don't do anything stupid. That's always a good mantra to live by. But thank you all so much for attending my webinar, and thank you to the OR Today folks, Jamie and Linda, for helping me out with this. We don't have a ton of time, unfortunately, for questions, but if you do have questions that we can't address here and now, you are free to email me at kanderson@hmark.com. Even if you don't have any questions and just want to ask me something not related to this presentation, I'm open to that as well. But there again is my contact info in case you do want to reach out.
Kevin, thanks for sharing that. If you'll leave the slides right here, we'll keep your contact information there. I know we're right at the 60-minute mark, but I was able to pull out at least 2 attendee questions that I hope we can get through some answers. I thought they were really great for the topic that you discussed today. So the first one was, what are good ways to assess the effectiveness of our department's communication?
Oh, that's a good one. So in case you don't have something already in place, a lot of facilities already use Gallup and things like that for polling people within a healthcare organization. But especially for you SPD folks, since there's so many of you and the managers and all that, I recommend you go and you talk to your OR staffs and your clinic and end user people, the people you're sending products to all the time. Send them surveys, send them questions, talk to them in person, find out what they think and find out how you're doing in terms of communication. I got so many ideas as a manager on how to improve communication and things like that just from going to the OR huddle, right? Those things and survey monkeys, there's all kinds of ways to actually enhance your communication with your OR or anybody else.
Perfect. The other question I wanted to be sure that we got to address was, how can we assess the competency of an employee's understanding of the critical communication tools they see, like signs or symbols?
Yeah, another great question. This is something that you might want to be more specific about what's going on in your department, whether it's SPD and OR, but you can develop very simple like quizzes and things like that with the actual pictures and labels and all that. Test your folks on them every single year, put it in their record. A lot of places have tools like HealthStream. Maybe you embed your quizzes into HealthStream and it automatically gets shot out to them every single year. I think that's a great tool for implementing those little quizzes and questionnaires for them that you implement.
Fantastic. Thanks for addressing those two. And attendees, again, Kevin's information is on the screen. The attendee questions that we couldn't get to or that time didn't permit, we'll send over to Kevin offline so he can follow up with you. Again, Kevin, thank you for such a great webinar today. It was very informative. I enjoyed it. And of course, thanks once again to our sponsor, Healthmark Industries. Just another quick reminder before we go today that the post-webinar survey and the certificate process is now automated. So the survey link will be included in a follow-up email, which you will receive in about an hour's time. Once you've completed that survey, you'll be able to download your certificate immediately. And as always, one lucky attendee will win an Amazon gift card for completing today's survey. If you have any questions about that process or this webinar, you can reach out to us at webinar@mdpublishing.com. And for more information on our upcoming OR Today webinars, please visit the website ortoday.com/webinars. I hope you enjoy the rest of your afternoon. We'll see you back for the next presentation.
Thank you.